Good. Huh? No, yet, not yet. Not yet. I know it. I know it. I know it. Still trying to help nurse a brother.
Oh, things coming along?
Yeah, it's coming along. And he ain't doing the greatest, but
Keep praying for him.
I'll please you. Please you. Yeah.
There's more important things than fishing when you got things like that to deal with.
I know that's right. Right now, I got a daughter on the ninth at Dr. Memorial Hospital.
Well, they pulling you in all kinds of directions.
Yeah.
Man, how many hats?
That's okay. That's okay. You pray for us that morning?
Yes, sir. We can do that.
About three? Yeah. Yeah.
Michael, we've been hunting turkey down the side. Put it through.
Couple of them over here, man, that's actually one of them has, I don't think the other one, say that's hard to hold. Pretty good, can't see much of it.
I flew with two of them in that clearing across the road from the gate up there.
Yeah.
Or there in the clearing, they followed it.
Somebody go in there, do a lot of yelling. You sit there and cut it, float a little bit, and have it pop up.
Got much pressure on there, they won't gobble much, anyway.
What relation are you to Mark?
Second cousin.
Here.
His daddy's daddy.
His dad, granddaddy. Oh, his granddaddy.
His granddaddy. My granddaddy.
Here. Candace Owens.
Did he?
Huh? He's still there, huh?
Rick? We'll stand for the prayer.
Lord, we do thank you for your blessings. We thank you for all the ways you provide for us. Thank you for this opportunity to serve. We do thank you, Lord, for how you bless this nation, and we pray that you'll continue to lead, guide, and direct us. We pray for all the leaders, Lord, and those that take parts. We just pray for your guidance and leadership. We pray above all you will be done. We thank you for, Lord, our law enforcement, military, and their families. We pray for your blessing upon them, first responders. Thank you for that. We just pray as we go through this meeting here today, Lord, that your will be accomplished. That you would give us insight and knowledge and guidance in all the things we can do. We thank you for that in Jesus' name. Amen.
Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. As always, in efforts to protect the public and the Board of County Commissioners, a conference line has been set up to accommodate community access to the meeting. Conference line number is 1-917-900-5 1022. Access code is 32347 pound sign. This is not a toll-free number, and you may be subject to long-distance charges according to your long-distance plan. When the chairperson opens the meeting for public comment, please follow instructions. If you wish to speak, please dial 5. The moderator will unmute your line when it's your turn to speak and notify you by announcing the last 4 digits of your telephone number. Please announce your name and address. You will be allowed to speak for 3 minutes. This meeting will also be live streamed on the Taylor County Board of County Commissioners Facebook page. If you wish to view the meeting on Facebook, you must have a Facebook profile. Search under the Taylor County Board of County Commissioners. You can view the meeting at 9 a.m. The Facebook live stream will not be monitored for questions or comments. Please call the conference line number if you wish to speak. Okay, with that being said, we'll go to number 3 on our agenda, approval of the agenda.
Motion to approve?
Second.
Motion second to approve the agenda. All right. The first thing on the agenda is the consent items. Anything on the consent items need to be pulled off, or are we going? Not.
Motion approved.
Second.
I've been motion second. All in favor?
Aye.
Good. Agenda approved. We go to request for the public. The vote to consider reappointment of a board member, one board member to the Taylor County Development Authority. Go back to number 12. The board to consider reappointment of one board member to the Taylor County Development Authority.
I can speak to this on behalf of the TCDA. They are requesting, or we are requesting this board consider reappointment of Mr. Ethel, and then there will be an additional application for the next agenda that I honestly missed for this agenda of an existing member, and they will continue to advertise for any positions that are left.
So this time we're just reappointing, okay?
Correct.
Motion, second.
Motion second. All in favor?
Aye.
You have 2 or 3 things going on. I was just a game, but I know what it is. Okay? We go to number 13, hospital life. Mr. Chris Smith, CEO of Dr. Memorial Hospital, to appear to provide operation and financial update.
Morning, Chairman Debs.
Morning.
Thank you for the opportunity to brief you on the status and state of health of your hospital, Doctors Memorial Hospital. It's my opportunity, in addition with our CFO, Mr. Fairclough, Doug Fairclough, to give you a state of where we are, a little bit of the landscape of rural health community hospitals, some of the impacts that we're experiencing from the legislature, and also where are we going with initiatives in the next several years. I'm going to begin the presentation and kind of focus a little bit on the landscape of the rural health, where we are. And you all are very familiar with the national state of rural community hospitals across the country. We struggle. We struggle considerably due to a number of different dynamics. In March of this past year, the Cecil Shepp Center for Health Services Research at the University of North Carolina released a report that 180 rural hospitals to date have closed, and that's since 2005. 136 alone since 2010, and last year, the most in 1 year, 20. 3 of them being in our backyard just to the east of us. Now, the number of variables that kind of take into consideration, one of them we're living through right now, the pandemic, but there are a lot of other variables that cause this issue. Community hospitals are afflicted by decreasing patient volumes. We've seen that. 48-bed hospital in past years has averaged a daily inpatient census of 3. Recruitment of physicians and specialists in the community to serve and broaden specialty access has dwindled over the past years. Physician alignment with health systems, healthcare policy and market changes, and decreased governmental reimbursement in the form of Medicare and Medicaid. Economic downturn pressures that we've seen with COVID and shortfalls in state budgets, in addition, access to capital. A recent American Hospital Association study indicated as much as a $53 to $122 billion shortfall in rural community hospitals nationally. 30% of rural hospitals are in our country, 30% that make up our 5,400 hospitals, and they serve 60 million people across the United States. But we have less potential of determining a positive operating margin and profits from our larger urban centers. In addition to that, when we look at healthcare quality and we look at the morbidity and mortality of our own populace, we are far less advantaged than those in the urban centers. I'm going to go back. So what is your hospital today? Right now, these are just some of the statistics that we have been working on and where we sit. Our inpatient offerings, we now average between 7 and 11 patients per day from that 3. That's about 15% utilization, total bed capacity of a 48-bed facility. Our outpatient services, which encompass surgical, laboratory, imaging, on average about 120 visits per day. Our emergency care services average about 30 patients per day. That's still less than 10,000 per year, which classifies us, according to CMS, as a low-volume emergency center. DMH's rural health clinics, we have 3 of them in Mayo, Steinhatchee, and here in Perry, see as much as 100 patients per day. And our community outreach totals as much as $1.5 million to our residents here in Taylor County. We have a significant amount of coverage for our non-insured, and we are one of your largest employers at 190 FTEs, operating an annual budget of $8.6 million in labor and benefits. What I'd like to do is turn it over to Doug to provide you a little bit of the state of the fiscal health.
If I could,
Yes.
the 100 per day, that's across the 3 clinics.
Yes. That does fluctuate a little bit. Sure, absolutely.
What I want to do is to give you an update of where the hospital is right now financially. As all of you probably know, our fiscal year ends in May, and we have really not made a formal presentation to the Board of Commissioners. It's our operating results for last May, for our fiscal year ended in May of 20. But I wanted to let you know that last fiscal year, during the year, we were actually tracking better than in fiscal year 19. And if this slide shows you the red line is our revenues in fiscal year 20, and the blue line is our revenues in fiscal year 19. And in January, our revenues were about the same as they were in 19. February, they were better than 19. And then in March is when the COVID really hit us and started affecting our operations. You can see in April, our revenues dropped from 5.1 million to 2.6 million in 1 month, which is a substantial drop. And they also dropped in May from 5 million to 3.4 million. And then our fiscal year ended right then. So this had a big impact on our fiscal year in May of 20. We had already started a very active program of reducing operating expenses even before COVID hit. And, we've been doing that through monitoring our personnel and also our supplies and other expenses. And in fiscal year 17, we reduced our expenses by 6%. And in 18 and 19, we reduced them 3% each year, and in fiscal year 20, we reduced our expenses by 5%. You can see from this slide that we'd already started here again, the red line represents fiscal year 20. And in January, we already reduced expenses from 1.9 to 1.7, and in February, they were about the same. And we reduced expenses in March, April, and May at the end of our fiscal year. And one thing that we really focused on is that since we're a service industry, over 55% of our total operating expenses are related to our employees and employee benefits. Even though at the hospital, we've never been able to have benefits other than we do pay a portion of the health insurance premium for our employees, but we don't make contributions to a retirement plan or have any other benefits other than the health insurance. But with that being said, we had already started reducing our staff. In January, we had reduced our staff from a little over 210 people down to 190. And you can see from this graph that each month we had reduced our personnel all the way down to, at the end of our fiscal year, we had a little less than 170 employees, which really helped us a lot in our operating expenses, since this is the majority of our expenses. And then as we wound up our fiscal year after our audit was completed, we wound up with a loss of $554,000 for fiscal year 20, after all was said and done. So far this year, we actually tracking better than we were in fiscal year 19. And we just closed the books for March, but we haven't totally released those numbers yet. But at the end of February, which was 9 months into our fiscal year, last year we lost about $140,000 for the 9-month period. This 9-month period, we've actually gained $294,000. So that's about a $434,000 turnaround from fiscal year 19. So we're expecting,
Could you repeat that, please? How much was that number?
it was about a $434,000 improvement over the prior year.
Yes, sorry.
So we're expecting fiscal year 21 to be a little better than fiscal year 20. The major challenges that we have at the hospital, I'll go over this real quickly, but on the left-hand side of this slide, you see a pie chart that shows this entire patient insurance coverage. We basically have 5 types of patients, or if you want to call them customers, because we're in the business of providing services. We basically have 5 types of customers. They're Medicare, which is represented by the blue section, which is 46% of our patients. And then Medicaid makes up 17% of our patients. And Blue Cross Insurance Company represents 14%. Other insurance companies, such as United, Aetna, and so forth, 13%. And then about 10% of our patients have no insurance at all. And the importance of this, and it impacts us, if you look on the right side, at the very bottom, we start off with the hospital expenses run about $40 for every $100 of services that we provide. And then if you turn that formula around, what that means is that our prices are 2.5 times what our costs are. And most businesses set their prices based on what their operating expenses are. If we were any other type of business, we would be in a profitable situation because we have our pricing structure based on our expenses. The hospital is a not-for-profit entity, but the not-for-profit is merely a tax election, and it's not really the way you should run a business, because no business can sustain itself without generating a profit. Without a profit, we don't have any money for capital expenditures to get new equipment and so forth, and have state-of-the-art equipment for our patients. So we really strive to make a profit, even though we don't have to pay income tax. the fallacy in our charges, a lot of people complain about hospital charges, and they'll say things like, I was dismissed and got charged $5 for an aspirin. That may in fact be true. However, the part that they leave out is nobody pays us based on our charges anymore. The reason that the charges are the way they are is that's the way the program started in 1967 when the Medicare program came into being, because they allocate costs based on charges. And all hospitals have to have uniform charges, and they can't deviate the charges from one payer mix to the other. But none of our insurance companies pay us based on what we charge. Medicare and Medicaid, which makes up 63% of our patients, are on a fixed payment system based on the illness of the patient. And they totally disregard our charges. And if you look on the right side, that shows out of a $100 charge what we actually get paid. You can see from the blue section that the Medicare program pays us $38 for every $100 that we charge a patient. And down below, I just made a point that our expenses are $40 per $100. So they're paying us $2 less than what our actual expenses are for paying the salaries of nurses, doctors, medical supplies, and so forth. And then if you complete the circle, the Medicaid program pays us $23 for every $100 charge. Blue Cross pays us $46, which we make a profit off of Blue Cross patients. Other insurance companies pay us $36, and then the individuals who have no insurance, we wind up usually collecting approximately $11 out of every $100 charge. So out of our 5 types of customers, there's only one customer that pays us a profit, and that's they only account for 14% of our patients. So the other portion of our patients, we're losing money on each one of them. Lastly, I wanted to go over with you, I'm sure most hospitals and also governmental agencies have received COVID financial assistance, and we did also. We received financial assistance from 3 different sources. One was under the CARES Act, and then we got Medicare advances from the Medicare program, and then we participated in the Small Business Administration Paycheck Protection Program. Under the CARES Act, we received $9 million in funds from the CARES Act. And that money has it only be spent for specific uses. It has to be for the preparation for the prevention of or the treatment of COVID patients. So out of that $9 million, we've identified about $6 million that's directly related to COVID expenses such as testing kits, masks, disinfectants, and things, supplies directly related to COVID. And we're expecting out of that $9 million to have to repay about $3 million. And we have that money in reserve so that when the time comes, we can repay it. On the Medicare advances, we received about $2.5 million that were just what it says, advance payments on Medicare claims. We received that money in April of 20, and we returned it this month in April of 21. Every penny of it was $2.5 million. So that money was really no help to us. We knew that we were going to have to, it was not to be forgiven. It was a loan we'd have to repay, and we didn't want to get in a bind having to repay that money. So we just never spent the money. We just reduced expenses rather than utilizing that money. And then the last funds that we received was, we received about $2 million from the Small Business Administration and the Paycheck Protection Program. We did utilize that money to retain some of our staff, to keep them from leaving, and we're going to apply for loan forgiveness on that, and we expect to have to repay about $200,000 of that, and then the remaining $1.8 million we have been able to utilize for our salary costs. Anybody have any questions on that portion?
So you were able to secure basically $5 million for COVID expenses and assistance?
Yeah, right about 6, yes, pushing 6.
I was trying to be conservative.
I'm sorry.
That's fine. I just wanted to be sure I understood that out of all those funds, basically between $5 to $6 million would be able to be retained by the Dr. Moore.
And one thing interesting about these funds is the utilization of them is that, like the Medicare funds, were basically no help to us at all. The CARES Act funds, in a way, are no help to us because they're not paying for the expenses they pay for. We would not have incurred those expenses anyway had it not been for COVID. So they're basically just, if we spend an extra dollar, they're paying for that extra dollar. But if we had not had the COVID pandemic, then we wouldn't have utilized or spent that money anyway. So it's basically paying for expenses that would not have ordinarily been incurred.
So it looks like then you had a third more expenses than you normally would have had, since you were able to retain a third of this fund in the CARES Act.
And I'll give you some examples of what's happened across the country with this type of expenditure.
But in that, I mean, you said some of this paycheck protection money was utilized to keep staff. In this last year, how much staff were you able to keep and how much has been released?
Paycheck protection.
No, sir, in total, as far as your staff is concerned, because of the shutdown and all those things, how many individuals from the Dr. Moore Hospital staff are no longer there?
Well, actually, I'm not sure the exact number, but you saw on that previous slide where our full-time equivalent employees have been reduced.
Right.
We have reduced staff during this time, and that's the reason we're gonna have to pay back some of that paycheck protection, because it's based on your full-time equivalent employees on retaining all of them, and we were not able to retain all of them, so that's why we're gonna have to pay back part of it. So we were able to utilize some of it for existing payroll. So that's out of the three programs, that's really the only program that's really been a real financial benefit to the hospital with that paycheck protection program.
Right. But in the previous reductions that the hospital was making, were any of those staff related? Because I think early in the presentation you were saying that there would be anywhere from 4 to 6% across these first or last 5 years that were reductions in costs or expenses. How much of that would be related to personnel?
You may try on this one?
Yeah.
I know there was some consolidation. We have consolidated a lot of different job duties into individuals. So what Doug was alluding to is over the last several years, we have reduced, I want to say probably 4 or 6% of the staff each year to try to bring down expenditure. So you might have an individual that has 3 different titles and 3 different roles, so you can just consolidate all of their duties into one and then reduce that individual, those FTEs accordingly. We are very lean right now in regards to that, and nursing is the most influential and most important component of this hospital, and that is one area we have to strategically grow. We've got to grow bench strength in order to be able to care for patients on the inpatient side. One problem that the United States is facing right now is the attraction of travel nursing. Okay, you might hear of a company, I'll use it, AYA, A-Y-A. They have recruited nurses all over the country and flown them to hotspots to practice caring for COVID patients. That's where a lot of this CARES Act money has been spent. So your big urban centers of Chicago and LA and Michigan and even in South Florida as well as in the Northeast have been sending nurses and paying nurses as much as $200 an hour in places like ICUs to care for patients. A lot of that money's been drawn from CARES Act, where facilities actually have that to utilize it. Jacksonville the same way. We lost 30% of our nurses in one medical center because the nurses went down to an as-needed role, left their full-time role, and went traveling in order to chase the money. And that's been an issue. Now, when that money stops, those nurses are going to come home. They're going to probably come back to their facilities where they work. It's a double-edged sword, to be honest with you. When you bring in a traveler, sometimes you're bringing in somebody foreign to the organization. The staff nurse that lives there, the DMH asks the question, why are they here and why are we not being compensated? So one thing we did last month was utilize some of that funding to help close the salary gap of our own staff, because when you look at us according to other areas, geographical areas, there is a huge gap. People are loyal if they want to stay home and not travel an hour to Tallahassee or to Gainesville. But again, you've got to build that. We don't have that large number. And that's one of our big strategies is how do we recruit more people? How do we close that salary gap so people do want to stay here and work here? Does that answer your question at all?
I think so. Yes, sir. I mean, but, you know, part of the issue as far as the folks that are traveling,
Yes.
we have no idea of knowing how long those funds are gonna be available as far as the virus and the outbreak and the conditions that are having to be worked through. So what is part of the plan moving forward to try to offset that?
Well, we've already addressed some of that right there. We already engaged Zaya. If we needed to pull that trigger to do so, right now we're trying to get our own from our own community. And that's pulling people from Madison, from South and Steinhatchee, you know, even pulling people out of Tallahassee, because we have so much partnership with Tallahassee, not just with our physician side, but also seeing what we do from the nursing side. I would rather pull that trigger first before I start bringing in, you know, the travelers. So that is a strategy that we have in our back pocket.
Right now, since you mentioned it, right now, the CARES Act funds are, scheduled to stop at June the 30th. We have heard some rumors that they may extend it till December, but right now, we're working on the current regulations, which is ending June the 30th, and we're trying to, manage our expenses accordingly to that due date.
I mean, not knowing what the conditions may be, certainly we would hope there would be some concession if there are further needs or demands for those services or the funds, and the funds, I should say.
You say you try to close that salary gap with travel agencies around the world. Closing that salary gap, are you gonna be able to sustain that, or is that gonna be?
No, that's a great question, and that's what I want to talk to you about. So every single thing we're doing now, we have to have some sort of sustainment. And I want to talk to you about several initiatives that we're putting in place so we can really look at that. We don't want to do, that's the whole thing about even with traveling nurses. If I were to throw that and build this huge workforce of traveling nurses here, and the money goes away, now what do I do with it? The other piece of that is our area has been very lucky. We have not been hit like other hotspots, you know, in a number of COVID patients that you're caring for, that you're having to hospitalize, that you're having to do home health on. When you look at the spread across the state, Taylor County has been very, very lucky with that. Where other areas, I came from a 200-unit COVID fleet hospital that we built inside the shell of a hospital, and that was always at capacity. So, you know, here's a little bit of a different cut. To your point, in the money spent here, that we had to put a lot into infrastructure. Because again, it's all the personal protective gear, which is very expensive, as we saw in the beginning of COVID. Plus, what do we do to
We stopped taking applications the end of April. That should give everyone enough time to receive their applications and have all of them processed by the time the GSG agreement comes to an end. Now, as of Wednesday, April 14th, the county has approved $319,000, a little over $319,000 for small business assistance and $74,000 for individual assistance.
70 what?
74. Yes.
So you want to start taking applications on April the 30th
Yes, ma'am.
to give a month, basically, to finalize everything. I don't have a problem with that.
Yeah, motion to.
No,
No,
sir, I wouldn't think so.
certainly in favor of not exceeding the deadline.
What have we got, 10 more days?
And GSG has really worked diligently with people to try to obtain all the information they need to process these applications. They have worked very hard with people to get these applications.
Just for the public's information, we wonder, will you go over the process for anybody within the next 10 days that needs assistance? What do they need to do?
They can go to the library and pick up an application, or they can download an application off of our website. Certainly, if you
TaylorCountyGov.com.
Yes, ma'am. And there's a separate section for CARES Act. They can certainly call me and we'll help them any way we can. Then those applications are mailed to GSG in Tallahassee. And that information is readily available. It's posted on the chamber door. I can make sure it's posted in other locations. And then once GSG receives the application, they go from there.
So just to sum it up, they've got 10 days, and they can get an application from the library chamber. They can go to taylorcountygov.com and download an application.
Yes.
They can call you, but these have to be in by the 30th.
Yes.
So that means that if somebody's gonna do it, they need to go ahead.
They need to go
Otherwise,
ahead.
after April, I guess, 12 midnight, April the 30th, if they come in the next day, they will not be accepted. Is that what you're saying?
Yes, ma'am.
Okay,
So
so
we do really need to have a point where we cut it off. Now, what I would say is if the application is incomplete, they need to go ahead and send it in. And if, not wait on, a piece of paper they may be missing. They need to get their application in, and if they're missing a document, GSG has several weeks to work with them to make sure they have all the documents that are needed, all the backups that's needed, and then that gives them basically a month to gather any missing documents, work with people as much as they can, and then, we can pay those, any of those grants or awards.
I just want to make really clear when the deadline is and what you need to do. And if you are past that deadline, there will not be any exceptions. That's what you're saying.
Yes, ma'am.
Okay.
And we've been running this program for, I think we're in our 6th week or close to it. This application has, this round 2 has been open for about, I want to say about 6 weeks. Also regarding our inmate work squads, as you all know, we lost our work squads on April 9th. In discussions with the sheriff's office, they have agreed to provide an additional work squad. I would like to bring an amendment to their current agreement to the board at the next meeting. What they are requesting to do is to amend their current fiscal year budget by around $51,000 in grant funds received from last fiscal year to cover the cost of the squad and to fund some additional personnel expenditures.
Sounds good to me.
What we are planning to do to address this huge lapse in resources is to ask the sheriff's work squad to primarily take care of mowing, and some of our take care of the sports complex, do as much as they can there, take care of our cemeteries, take care of all mowing. Trash pickup if they're able. We're really going to have to take it one day at a time to see how all of this shakes out. This is something we haven't had to do before, and we're basically replacing 2 6 or 7 member DOC squads with 1 probably 4 member jail squad. So we're really going to have to just try it and see how it works out. What I'd like to do is to hire an additional full-time custodian or 2 part-time custodians to clean the restrooms and empty trash in the interim. So our goal is really to get through the end of the fiscal year, see what happens with the Department of Corrections, see if our work squads are returned, and really just try to fill these gaps as we can.
Okay, on the custodian that you're talking about full-time, we've been advertising for a part-time attendant for Hodges Park. And since sports is seasonal, and pretty much Hodges Park is seasonal, could it be that this person would also, in the summer, take care of Hodges Park in lieu of hiring another part-time attendant for down there? Because by that time, pretty much the sports are going to be over pretty soon. Organized sports like soccer and baseball and softball.
Well, that custodian wouldn't really be involved in the sports complex as much as taking care of all of our facilities through the county. Obviously, if we can do that, that's what we'd like to do. But as a segue into the next conversation, we have 26 openings now, 8 full-time, 2 part-time, 13 seasonal, and we haven't had an application in a month.
People don't need to work.
That's why,
Getting paid too much to stay home.
that's why this individual assistance needs to be done.
So
So,
we have,
contractor,
sir,
is there a possibility for contractors?
possibly.
Well,
And we can't, I don't want to wait too long.
Right.
I would like to give. No callers.
No problem.
No, sir.
Okay. Board affirmation, right? Go ahead.
Okay. Now that we have, a little bit of resurfacing going on with our roads, and I know of two different roads that, property owners are requesting for us to put in culverts and put in turnoffs for them, where there has never been a turnoff or a culvert. And I spoke with LaWanda yesterday, and we did discuss, we have an ordinance that, if we're resurfacing or if we pave a road, if you have a driveway or a culvert there before, we'll replace that. But if you've never had one, period, then we're, according to our ordinance, we're not gonna go in and build you or turn off and put a culvert in. And, I don't think that all the public quite understands that.
Only apply to existing turnoffs or culverts.
Yeah, or if there's, yeah, I mean, if there's been one there, then, but if there's not been one there, then we don't do that. The other thing, LaWanda, when, do you think that we will start discussing, having our budget meetings and discussing the budget?
We have not started our, and typically in May is when we prepare our draft budget, or a budget request. And, normally around the end of May is when, is the deadline for sending to finance. So I would not think until June or maybe July. Isn't that typically the timeline, Gary, around July?
Yeah, we usually start them in July
Yeah.
first. I think they go out to the departments in May, and then in June, the finance department prepares the budget, and then in July, they present it.
I'm already kind of thinking about the budget process already. But when you do, decide to schedule the meetings, just if you don't mind to just check with each one of us, because some of us have children.
Oh, absolutely.
They've got camps and vacations and all kind of things planned during that time. So, I just want to make sure that we all can attend.
I'll bring back to the board, I would say probably sometime in June, before we schedule the actual meetings.
Yeah.
And hopefully by May, we'll have the, some type of estimate from the property appraiser's office as far as the values. So hopefully the first week of May, maybe we'll have a better idea of what to expect as far as our revenue, for a general fund.
The other thing we typically do too is we usually schedule more meetings than what we need to, so like if somebody could make one and we need to not have that one and skip it, we usually have, more scheduled that we don't use all of them.
And I know that we've been very busy at the sports complex, but are there anything in the works for tournaments?
TCRAF has discussed several possibilities, and at our last meeting, we did discuss some type of uniform fee that we should charge for any tournaments. I believe the last tournament we had, Babe Ruth set the fees, and we agreed to them or something along those lines. So between now and the next TCRAF meeting, we have asked that the members review. We have a draft policy or application for use of the sports complex that has not been approved from the board. So we did give it to our TCRAB members and ask them to review to help us come up with some type of uniform charge that we could apply for these tournaments, and some type of understanding as far as concessions and field use and exactly, what each side the commitment would be. So I would hope in the next TCRAB meeting, we would have some input. And then what I'd like to do is to bring that application to the board. It's similar to the one we use in our other facilities. And that way, if someone wishes to use the facility, it doesn't take board action. We can ask them to complete the application like we do for Forest Capitol Hall.
Yeah, well, we all know we have a phenomenal sports complex out there, something really for this community to really be proud of, and it's being well kept and maintained and run, and I'm really thankful for that. And Commissioner English, I want to thank you for your participation on the TCRAB. I'm excited about what's going on there because of what I've heard. So thank you for your service there.
Appreciate that. We're heading down the path, with, change the look of baseball, going forward. Like you said, just what you just mentioned about tournaments, talking to several folks that run tournaments in other big communities, Panama City, South Georgia, and kind of what their criteria is, and kind of what Wanda said to the board now is, take some of this information and kind of compile and come up with a good criteria when somebody wants to hold a tournament here, that slide it over to them and, you meet this criteria and all the time. So, headed in a good direction.
Good. Thank you for what you do there. I don't have anything else. It's just, it's a privilege and an honor for me to serve my community. Thank you.
I was called yesterday from a Missouri ordinance reference that piece of property Pam brought up about the colors. There wasn't a paved road there by her property all the way down beside her and her two brothers' property. And we got the road paved, but they had to sign a waiver for them to pave that road. And in agreement, the word was, she said, that the engineer said they would have a right of way across that deep ditch that they dug. They dug a ditch all the way down inside their property. Used to could drive onto the property. Now you can't drive unless you got the four-wheel drive on and go across that ditch. And she's real upset about it, and I don't blame her. They have no access. There's three owners on the 3.2 acres, her and her two brothers. And I can understand, when you go there and dig a ditch where somebody can't get off the road, they've been, had access all these years to their property, and dig a ditch, they need to be at least one acre, there needs to be one outlet where they can get on their property. I mean, the county dug the ditch to pave the road. And the people, they didn't have to sign that. They could have said, no, we don't want the road paved, and the ditch wouldn't be there. And the road wouldn't be paved. And, I don't know who's telling the truth, but the engineer said that she didn't ask that and they didn't have an agreement. She said they did. So that's a bad situation. And, we need to address any piece of property from now on that the ditch is going to be dug down, slowly cut off the same way. There was a piece of property out there, the ditch was dug, people did not have no access to their property. And, in the future, we're going to pave a road or dig a deep ditch down the side of the road that we're going to repave. We need to clarify with all the landowners down that road about access. Because that piece of property out there, they got two property owners on either end, they can't access no kind of way besides off the highway to that 3.2 acres. And the same way on Foley Cutoff. The neighbors owned property all around, they couldn't access nowhere across that ditch on Foley Cutoff. So in the future, y'all, in your districts, I'm just giving you a word for thought. When a road's gonna be paved, and there's new engineering plan to dig these deep ditches to get the drainage like it should be, And I understand that part of it, but we need to look ahead and talk to the landowners on the road and make sure that they're good with digging a ditch there if they're gonna sign off on anything on it.
Well, the thing about it is, if there's never been a turnoff there, I mean, I understand why the ordinance is in place. If we start doing that, you can certainly, take away a lot of your road paving money because those things cost a lot. And as we all know, we come short on resurfacing as it is without all these additional turnoffs. But the other thing is too, when we resurface or we build a road, we've improved the value of the properties along there. So if they decide they want to sell their property, then they can certainly advertise now, we have a paved road, which increases the likelihood that people would be more interested in that property. It increases that value. I have a concern about if we start doing, and I understand people being upset. I understand where they're coming from, but then on the side of trying to run an efficient government and balance off what's right, we have a huge responsibility to watch our dollars and also to do what's right. But I think you might be opening up a can of worms. But if we have funding, if we have the funding for it, that would be one thing that would be different.
Well, that county can fill that ditch back in just like it was, and it wouldn't hurt nobody with them right there. I mean that, them people can't even drive on their property now, right, going down through a deep ditch. Even though they didn't live there and they didn't have there or anything, they don't have access, easy access to their property now.
Yeah, well, we own a tract of land out, north of town, and we have very deep ditches, and there's 3 of us, and it would be the same thing. Okay, there's 3 of us, and to come to the county and say, okay, I want y'all to put me a turnoff in. I don't want to spend my money to do it. I want y'all to put me in a turnoff.
Well,
I never thought about doing that. I always just assumed, it's my responsibility to put my own turnoff in.
but if they went out there with a tractor and cleared 3 driveways going into them woods right there, and said, we got 3 accesses, we want 3 culverts in, then you'd have to put them in. If what you're saying right, if there was ever access there, but they was just dropping off flat ground into their property before the road was paved.
But that road did improve the value of all the properties too.
And if I'm not mistaken, I believe our current policy does require landowners to obtain a right-of-way use permit or, a driveway permit. And if it is determined necessary for a culvert to be installed, that is, the culvert and the rock is the responsibility of the landowner, just to follow the policy that we have in place. So, although I do understand the private landowner's concerns, I do feel like our engineer is well aware of the ordinances and the policies that we have in place. So I don't know where the miscommunication was.
I'm aware of the ordinance too, but the thing is, the county dug a ditch and stopped them from having access to their property. And without them signing, they couldn't have paved that road to start with. And they were told, is what they're telling me, that they were told that they would have access, a driveway would be put in if they sign that paper. Now I want y'all to understand what I'm being told, and y'all can ask the people yourselves if you can get the same word. But now, I know it's a two-bladed sword, but the thing is, they got a piece of property today, they wanted to sell it. So, well, you can buy it, but you got to get some culverts put in before you can drive on it, And there's 3 members in that group that owns that piece of property. And I checked the zoning on it, you can build 4 houses on that 3.2 acres right there.
Done the best to do what they did work with. when I saw that half a mile in there, this stuff, I followed her in there. Whew. I don't know how she's gonna get out. She said something happened to her while the water was high. How would we get her out?
If I'm not mistaken, we have response vehicles. We have a high water vehicle, that the fire department has access to, and I believe the sheriff's office has several vehicles they can use in case of an emergency. So she may not be able to get out, but normally.
They can get in there to her.
Yes, sir.
And it's a private drive, not a county right away?
It's a private drive.
Drive, I think 7 people on that.
There's a couple over in my district that, the same scenario, they've been, that's a private drive, but they're pretty rough. Especially with rain like this weekend, getting in there.
And I reckon I don't know, do we need a register or something like that when we have these situations? And it should be with the county administrator, the county, who's over the roads? Hank Evans?
What kind of registry are you?
County roads going into, roads off the, driveways off the road. So if it was ever need to get in there, that would be, you can look at a map or something like that and find out where these roads at and get in and help people if they need to.
Oh, we can certainly pass that along to dispatch. That's what we typically do, is, I can ask the fire chief to take a look at this residence, and if they are unable to obtain entry, then we'll certainly, alert dispatch, so they have that within their database.
That can be comfortable. Okay. Right it out. There's no more comment? Good, that, Jim? Motion to second. Favor?
Aye.
Okay. Meeting adjourned.
Line muted.